Let's wait for a while for more people to come in. Please like and share. Give me a lot of heart shake. Today's topic is about feeding. Give me a lot of heart shake and like and share. Let's wait for a while for more people to come in. Today's topic is about feeding. Okay, baby feeding. How can we get more better feeding result? And also, why baby refuses to drink milk? This is a very common issue. If you face this issue at some point, let me know in the chat box. Are you a new parent? Did you ever experience like it's milk time and baby refuse to drink milk? Let me know in the chat. Let me know in the chat. Are you first time parent? Today's topic is about feeding. Okay, there are a few reasons why baby refuse to drink milk when it is milk time. Okay? One of the reasons is digestion issue. If baby is feeling any discomfort in the digestion tummy area, whether it's gassy or feeling a bit of pain or any discomfort, like even adults when we eat, sometimes we'll feel like we didn't know like what did we eat actually caused like a little bit of like tightening, cramping, and all those feeling. It didn't feel comfortable to us. So it can happen to babies as well. Is why they refuse to drink milk when it is milk time, because one of the reasons is because of the digestion issue. What are they feeling? Are they feeling uncomfortable? Are they feeling like a little bit of pain or too bloated with the wind? Okay. Hello Moonty. Hi. Are you a first time parent? Have you ever experienced like when it comes milk time and your baby refuse to drink milk? Tell me in the chat. Welcome. And today's topic is about feeding. One of the reasons that baby refuse to drink milk when it comes to milk time is because of digestion issue. There's a discomfort, there's pain or bloated. Okay, have you ever experienced such issue with your baby? Put in the chat. Let me know. Are you first time parent? Please like and share and give me a lot of heart shake so that we can continue. Okay. So nowadays many babies, they have this acid reflux. They have this silent reflux and all that. It is hard for them to drink milk when they feel uncomfortable along the way. Yeah. Okay, give me a lot of heart shake. Please like and share. So one best way to avoid the tummy discomfort is also not to keep changing formula. If you are feeding your baby formula, try not to keep changing unless there's a reason to change. If not, don't keep changing, because to adapt to a new formula, it may cause some discomfort as well in the process of digestion. So don't keep changing formula. Okay? So the next reason why baby refuse to drink milk when it comes milk time is because they are not feeling well. They are physically sick or they are having any infection. When babies are unwell, they are most likely not interested in drinking milk so much. Okay, there's no desire to drink milk. Okay, when they are not feeling well. So it can affect, like even if they have cough, because when they drink milk, right, they have to suck and then they have to swallow, they have to breathe. But if let's say they have cough, they have flu, right, there's phlegm blocking the passageway. When they want to breathe. It is hard to breathe when they are drinking milk. So when they are not feeling well, or when they have ear infection, cough, cold, a lot of phlegm, throat infection and all that, whatever discomfort, it will affect the feeding. Okay, please give me a lot of heart shape. Just click on the heart shape. Give me a lot of heart shape. Give me 100 heart shape. I'll be sharing family, mommy and baby tips during lunchtime as much as possible from Monday to Friday. Do join in from Monday to Friday during lunchtime. Okay. If I'm too busy, then I may give it a skip, but I will try to do it every day during lunchtime, Monday to Friday. So do join me. Let me know, are you first-time parents? Are you first-time parents? Have you ever experienced like you want to feed baby, but baby not interested in feeding, or cry halfway through feeding, or just arch the back and like turn the head and refuse to drink it? Have you ever, as a first-time parent, at some point face this situation? So we are talking about why baby refuse to drink milk. One of the reason is digestion issue. The other reason is perhaps they are sick with flu, cough, throat infection or ear infection or things like that, a lot of phlegm in the system. So when they suck, they swallow the milk, but when it comes to breathing, it's hard to breathe because of the blockage, okay, the phlegm and all that, when they are not feeling well, or coughing. So it will affect the feeding. Okay? It will affect the feeding. So another reason, around like 6 months or 5 months or so, starting from 4 months onwards to 6 months, you know that they are like teething. When they are teething, it's very obvious. It's like they like bite hard and then they try to pull. It's like it is very, very sore and very, very uncomfortable. So the focus will be all around the gum, will be hard for them to want to drink milk, because of teething. So when they bite hard and then they try to pull like this, then it is like teething. So that is the thing. Teething wise, I had one new mother who ever asked me, can she put her breast milk into the freezer, the ice cube, and then make it freeze to a cube and then feed baby with the baby feeder, like the feeder with the net. Okay, then I told her the reason why she should not do that, because baby's stomach need to be always kept warm. Anything cold is going to affect the digestion. Okay, especially for babies that age, just that first few months. So we have to make sure that the tummy is warm. Get it? Yeah, the tummy must be warm so that the digestion is better. And when they are cold, right, when they are used to taking cold things, it is very hard as they are growing up to keep that habit of not drinking cold or eating cold. So it's best that during teething time, don't introduce like things that can be ingested and then it is cold. Okay, you can have like even like a spoon, porcelain spoon or something, put it in the fridge and then it is cold, baby can bite on it. Yeah, or anything like teether, and then you can actually put in the fridge and then let baby bite on it. It soothes the soreness of the gum and baby can feel better. Okay, more comfortable. Okay, are you first time parents? Have you ever experienced like your baby refuse to drink milk when it comes to milk time? Let me know in the chat. Are you first time parent? Welcome. So today's topic is about feeding. So it's about teething. You can give something cold to bite on to soothe the soreness of the gum during teething time, but don't give anything that is cold that can be swallowed. Okay? Because it will weaken the body over time when we introduce cold. It is actually quite bad. Last time when I was taking care of my baby boy, I didn't know that. I gave like cold juice, because when I juice something, I juice for a few days. I don't just juice and then drink immediately, so as to save the cleaning up time and all that. But I realized that as my baby was growing, the chest, right, the stomach was always easy to have cough. Yeah, easy to have cough and like sinus and all that. So don't introduce cold when they are young. Alright, so teething can affect feeding. And the third reason why baby refuse to drink milk when it comes feeding time is because of what? Consider whether there's any change in the taste of the milk, whether it is fresh, direct latch, or frozen milk, express breast milk, and then you warm it up and then you give it in a bottle for the baby to drink. So some babies are very particular about the taste, about any change in taste of the breast milk, of a change of formula milk, or from breast milk to frozen breast milk, but then warm up to feed using bottle, or when there is a change in from breast milk to formula milk, or from one formula brand to another formula brand. So any slight change in the taste of the milk, baby may refuse to drink. Some babies are like that. They are very, very particular. Once they detect like something is different, they refuse to drink. But they are hungry. And also consider, if you are breastfeeding, how many of you here are breastfeeding mom? Have you ever experienced your baby refuse to drink milk out of a sudden? Okay. One of the reasons is look at what have you eaten recently, any change in your diet if you are exclusively breastfeeding. And suddenly baby like refuse to drink milk, like it smells different, it tastes different. So is there any change in your breast milk, in your intake of food that cause a change in the breast milk? Okay. And also be careful. Some of my clients, they are first-time parents, and they are quite confused about the fact that some babies can be very particular about the change in the taste of the milk. Not only the taste of the milk. There's another reason. There's another reason related to the taste, but it is not about the milk. Hello, welcome. Vera. Megan. Yeah. There's one more reason, that is the tip of the bottle. If you use silicone, stick to silicone if baby is okay with it. If there's any change from silicone to other material, okay, then baby may not want it. So then refuse to drink milk. Like it doesn't matter to us. It doesn't like pose something accuse or hints to us that why should there be why should baby refuse to drink milk because there's change of teeth. But some babies are very particular about any change in terms of feeding. Yeah. So it can be what the breastfeeding mother is eating. Is there any change in the diet? Okay, if you suddenly drink something, eat something that is that, like for example, like you take a lot of like garlic, onion, yeah, that could be the reason why the breast milk tastes different or smell different, and it affects your baby feeding time. Okay, another reason is what? The flow of the teat. Did you upsize too soon? Baby wants to drink milk, but because the flow is too fast, baby just refuse to drink milk. Like there's a difference in the flow, and baby is not prepared to go to the next size. Yeah. So it can be the flow, it can be what you have eaten, including what? Many first-time parents miss this out. Including what? And it can also cause digestion issue, and baby particular about the taste. It can cause digestion issue in your baby. So what is it? Okay, what the mother is eating affects. And are you drinking like milk, or are you eating any dairy product? And that dairy product in some babies, they just won't agree with their digestion. So that is another reason why baby refuse to drink milk, because it will eventually cause like discomfort in the tummy, disagree. And one mother told me that many after confinement, there's no red dates water to drink, right? No one to cook for you the herbal soup and all that, right? After confinement. And what we normally do, and when we are breastfeeding, it is not a time to reduce the excess water retention or the excess baby weight. Okay, so we can't actually eat less. We have to eat more, maintain, and then continue to breastfeed when we are breastfeeding, right? So then what is the next best besides drinking water? We will drink like Milo. Yeah, one mother told me that because of the Milo, right, she realized that her baby was always crying in pain. Yeah, so anything with dairy product, think about, is there anything that you eat that contains dairy product, and that dairy product may cause discomfort in the baby digestion. Yeah, so then it can affect the feeding. Baby cannot feed well. So why baby refuse to drink milk? Digestion issue, and then the illness, the infection, and also teething, and then change in taste of the breast milk, or temperature. Is it too hot? Is it too hot? Or is it too cold? It must be like the body temperature, it must be quite consistent. Okay. So that is the thing. Or did mother take any medication, under any medication, even though it's safe for breastfeeding? You have told the doctor that you're breastfeeding if you're not feeling well. Will that cause a change in the breast milk as well? Right? And sometimes baby get a bit distracted. Why? Because mother doing the postnatal wrap with the herbs, right? The Jammu herbs, right? And then what happened is the herbal smells, the baby was like, what is this? And then get very distracted. Have you ever thought about that? Hello, let me know whether you're first-time parent. Have you ever experienced when it comes feeding time and your baby refuses to drink milk? Hello. Oh, good morning. Matthew. Yeah. Hello. So our topic today is feeding. Do join me during lunchtime, Monday to Friday. I'll be sharing family, mother, postnatal mother, and also the baby tips. Okay, if I'm too busy, I probably give it a miss. But normally I would just share during lunchtime. Okay, you can eat while listening to me, no problem. Okay, so far. So baby refuse to drink milk when it comes feeding time. This is at some point, parents got to face this. It is quite common. It is quite common. So developmental milestone, why it affects the feeding? Because when your baby is bigger after like 3 months, after the 4th trimester, 0 to 3 months is the 4th trimester. After the 3 months, the first 3 months, baby will be slightly bigger, and then they are more curious, and they can see a bit further away, right? They can see. So they are more curious about the environment, and they get easily distracted. So that is the reason why they refuse to drink milk. They feel sudden, what is that? What is that? So they get easily distracted during feeding time. So they may resist feeding or prefer, as they are growing up, like when it comes to 6 months, when you introduce semi-solid food, nothing less than that. Yeah, because their digestion is very immature. So from 6 months onwards, when they can sit upright. So it makes sense, because when they can sit upright, they can eat. Yeah. So when they are lying down on their back, they probably is the milk that makes more sense, right? Yeah, so nothing less than 6 months. And the World Health Organization also recommends like 6 months onwards to feed your baby semi-solid food. So when your baby at 6 months onwards, a kind of like not that interested in milk, it is also normal. It is also normal. And they are more interested in the semi-solid food. And once some babies, when they are on semi-solid food, right, they love it. They love it. They refuse to drink milk. So you can put your express breast milk in somewhere in the food. Like if you smash the banana, the ripe banana, right? Then you smash it, you can add a little bit of your breast milk inside. So you add a bit here and there during the daytime, so that you can still get your baby to drink, to get some milk, yeah, with the semi-solid food. Okay. So another reason why baby refuse to drink milk is because of overfeeding. It's already too full. It's already too full. The one who control the milk intake using bottle will be the one who is giving the baby the bottle. If the mother is breastfeeding, then baby would decide how much the baby wants to drink. Make sense? Okay, give me a thumbs up. Give me a lot of heart shape. Yeah. Give me a lot of heart shape. Do join me every Monday to Friday during lunchtime. Today's topic is about feeding. So based on the caregiver, whoever that person is, if the caregiver feel like baby should finish all the milk and then try to keep feeding, the baby sometimes like can't can't stop the flow, then the overfeeding can result. And what is the problem with overfeeding, or like you try to like force feed the baby to finish the balanced milk? Like it can be a 20 ml or 30 ml of milk balance, and then the caregiver feels like, oh, the baby should finish, and then try to feed and try to distract the baby and try to feed and try to shake the baby and then try to feed. Okay, what is the problem with that? What is the problem with overfeeding or force feeding? Okay, sometime down the road. Hello, no? Yeah, hello. I'm not very good in pronouncing name, but I know you're in. Welcome. So what is the problem? We are talking about feeding. Baby refuse to drink milk when it comes feeding time. At some point we will experience that as first time parents. Alright, let me know, are you first time parent? Okay, give me a lot of heart shape. Please like and share. Okay. What is the problem with force feeding and overfeeding? Like they finish the meal, they should finish the meal, right? What is the problem? Because down the road, right, at some point, right, they may develop what is called like aversion to milk, like bottle aversion, like once see milk, I scared already. Yeah. So we want to feed the baby when the baby is hungry, not the crying stage yet, like just starting to feel hungry. By the time they are crying, they are over hungry already. So it's best to keep close to them and then observe what is the next feeding time. First time parents must always know this. What is the next feeding time? A few minutes, 15 minutes before the feeding time, observe your baby. Is your baby showing sign of awakening and then showing sign of hunger? You must act fast. Before the crying stage. Okay, we don't want the baby to cry every time when it comes to milk time, because they ingest too much wind when they are crying. So your action must be fast. If you need 10 minutes to warm up your milk, get ready. Factor in the 10 minutes. You know what time you expect baby to wake up. Especially like slightly older babies, like after 1 month, 2 months, you roughly know. Okay, you roughly know. So then act fast. If you need 10 minutes to warm up the milk, okay, then factor in that 10 minutes. Okay, when the baby is already in the crying stage, so hungry for milk, then what happens is you tend to overheat the milk, and then you take more than 10 minutes to then cool the temperature of the milk down before you can feed. So that is a delay of how many minutes. So keep track of when is the next feeding time. When do you expect baby to wake up for milk? Okay, so get everything ready. If you are making formula, you can always make earlier, no problem, because the formula can be, after you make it right, can be in the room temperature for 1 hour. Okay, can be in the room temperature. And this Singapore weather is very humid. Okay, easy to have bacteria grow. So in terms of the formula and the milk we make, right, so make sure after 1 hour you have to throw it away. Okay, and the whole tin of formula is like, after you open it, it's like 1 month you have to just throw, or you can drink it, no problem. Ask the husband to drink. Okay, baby food we can eat. Our food they cannot eat yet. Okay, Sophia, welcome. So remember, don't overfeed or force feed your baby, especially the younger they are. They just need to drink what they need to drink at a comfort level for digestion to go on well. Okay, because if we always overfeed, especially using bottle, then baby can't control. It's like their natural reflex is to suck. And when baby is like turning away and all that, you just try to distract baby and try to force feed. They arch the back, try to feed and all that. Then over time, at one point, they can have an aversion. They can develop an aversion to milk. It's like see milk bottle really scared. Okay. So this can happen when caregivers try to feed the baby too much, or when the baby is actually not hungry yet. Sometimes you have to wait like 5 minutes, 10 minutes before they get hungry. So feed when they are just starting to feel hungry, before the crying stage. That will give you better feeding result. Okay, don't do the opposite of like feed when they are not hungry. Okay. So another reason is emotional reasons. Like baby can sense that the caregiver is a kind of like stress out, there's tension or anxiety, and then baby will not be relaxed to drink milk. So when it comes to feeding, we want the baby to be relaxed. Then baby can drink milk, not over hungry, not when they are not hungry. So just starting to feel hungry, and then you catch that timing, and when you are relaxed, baby is relaxed, baby in the relaxed stage, baby can actually drink better. Okay. Hello, welcome. Shirley, if I pronounce your name wrongly, forgive me, I'm not very good in pronouncing name. Welcome, John Williams. Yeah, that I can pronounce. Because my time was like very simple name, John, Susan, Peter, Ivy, Mary. Those are very simple names. Nowadays the name is the name quite different. They can change the spelling and all that. I want spelling to make it unique and special. So can be a challenge for me. Hello, welcome. Give me heart shape. If you like it, thank you. Thank you. Give me a lot of heart shape. Give me 10 heart shape. Everyone give me 10 heart shapes. If you wish, like and share. And if you wish, you are free, join me from Monday to Friday. During lunchtime, I will go live anytime, sharing about family, baby, and mommy care topic. And you can actually tell me what you want me to share, so that Nick, welcome, so that I can share it in the next live TikTok. Okay, and click on my bio for more information, whatever you are looking for. All right. So another reason why baby refuse to drink milk, and I see many among my clients, among the new mothers, sometimes they bring the baby to my shop at Citygate, Singapore, for baby hair shaving. So I observe, yeah. I observe. What did I observe? Baby was actually very tired. So will you be interested to eat when you are overtired? When you are overtired, do you want to eat or do you want to sleep? I've seen many parents who brought their babies out, like after confinement, after the 1 month of confinement, they bring the baby out kind of too much, because they like can't be confined. I mean, who like to be confined? We want freedom, right? Freedom to move, to travel and all that. Okay, but you need to understand, newborn baby, especially the first 3 months or 4 months, below 6 months, if you bring your baby out too frequently, it will affect the sleep, it will affect the feeding. For sure, because they are too curious, and then too many things, too noisy, too bright, too many people and all that, can affect the feeding, and also their sleep. They cannot sleep as much or as well. Okay, when it's time to sleep, and then it can be too noisy and all that, they can't sleep. So over time, parents don't understand. Even if you bring your baby out just 1 day, like a Sunday with family and all that, just one day the sleep will be affected for the next few days. And when they eventually don't get enough sleep, what will happen is they will be lack of sleep. And over time, when you're always lack of sleep, what happens? You'll be overtired. An overtired baby in the daytime will be harder to sleep and harder to fall asleep and stay asleep at night. So then it becomes like a cycle, okay, lack of sleep. And when you reach to a point when you are so tired, so exhausted, okay, same like for baby, would you like to eat or would you like to sleep? So many times I told my client, okay, your baby is actually overtired. And overtired babies, they don't have appetite to eat so much, and the parents' concern is milk is the only nutrients for the baby. And if the baby refuses to drink milk, then it worries the parents a lot. But I pointed out to them, it is not the feeding issue that you should focus on, it is getting your baby to rest. Don't go out so much. It makes a big difference. So over time, if you can stay, things will improve. Baby appetite will be more regular, and then it will be easier. I'm good. I'm always good. I'm always happy to share about baby. Yeah, I love babies, especially 0 to 3 months, because they are so helpless, and I'm their voice. I know what is going on. I tell parents what is going on, and then they know what to do to calm the baby. Yeah, that's what I love as my job. So overtiredness is your baby. Observe in your baby. Is your baby overtired? That cause a drop, significant drop in the milk intake. Okay. Another reason why baby refuse to drink milk when it comes feeding time. What is the next reason? Or perhaps the last reason I want to share. Give me a lot of heart shake. Give me 10 heart shake. Everyone give me 10 heart shake. And like and share if you wish. Click on my bio if you are looking for anything. Just check it out. Okay. What is the last reason that baby refuse to drink milk when it comes to feeding time? It is too much trapped air. Mommy, daddy, can't drink because the air bubbles is taking up space in the stomach. That's why we must prevent the crying. Before the crying stage, we have to take action fast for whatever they need, so that they will not cry and ingest the wind, the air. And the trapped air bubbles will go to the stomach and taking up space in the stomach, and baby can't feed a full feed. Okay, hungry but can't feed a full feed is already full. Okay, but full with the air bubbles, partly because of the air bubbles. Okay, so we want to actually avoid that cry. Too much trapped air. So I've covered a few reasons why babies refuse to drink milk when they are hungry. Number one is digestion issue, like colic, like reflux, or discomfort or pain. When there's anything going on in the digestion, they are not so ready to drink milk. Okay, and then number two, illness and infection will also affect them, their appetite, teething. All right, and then number four, a change in any slight change in the taste or temperature of the milk, including if you use the type of silicone tip and then you change, okay, that will also affect. Okay, any change in taste or temperature. Number five, developmental milestone, like they are easily distracted because they are busy already, they are bigger already, and then easily distracted. Okay, another reason is overfeeding. Overfeeding, force feeding or overfeeding. Eventually they will develop an aversion to milk. See milk scared. See milk bottle scared. Okay. And then emotional reason, like caregivers are very tense out, very stressed out, and there's anxiety, and then baby feel upset, and then affects the milk intake. Overtiredness, okay, overtiredness is a result of like baby refuse to drink milk. There's a significant drop in the milk intake. That worries many new first-time parents. Okay, so the last I shared was too much trapped air bubbles in the stomach that's taking up space. That's why they can't take in more milk. So that is about feeding, why baby refuse to drink milk when it comes to milk time. Okay, so observe in your baby at some point in time, parents, you need to handle this. Yeah. Thank you for sharing. Thank you for sharing. Thank you for joining. Okay, how to have better feeding result? Are your first time parents? Okay, give me a lot of heart shape. Everyone give me 10 heart shapes. 10 hearts. Give me 10 hearts. If it is convenient to you. Okay, then the next question is how to have better feeding results. How to have better feeding results. If you are breastfeeding, of course recommended by the World Health Organization for the benefits of the mother and the baby is to breastfeed for 6 months, but obviously it is up to individual how you feel about breastfeeding, and there are many factors that goes into breastfeeding. We want to respect what the mom voice, whether she wants to breastfeed or whatever. Please respect her voice because she's the new mother. We want to acknowledge and respect her voice. So it is up to her to decide when she wants to stop or whether she wants to breastfeed or how long she wants to breastfeed. Alright, please respect her voice. And husband is to support your wife in what she wishes to achieve or what she wants to do. Okay? So it is the mother and baby team how they work things out. So to have successful breastfeeding, number one is you need to have some basic knowledge about breastfeeding. It cannot be like it is a natural based on mother's instinct and then boom, you can just do it. It is not like that. In today's society, it's very much learned knowledge. That's why we need to take course. Yeah, it's very much learned knowledge. Why? Because in the past, we live with our extended families, big families, okay, big families, 10 children and all that, okay, big families, extended families. So we get to see, growing up in our in the family, we see how our mother, how our aunties and all do the baby care, the breastfeeding, the potty training, and all the basic baby care and all that, okay, in our life before we get married. And when at some point when the couples got married, we formed a small nuclear family, okay, and over time we don't have so many siblings anymore. Yeah, parents don't give, hello Nana, welcome, let me know, are you will it cause, is it wrong to soothe the baby like by latching? It is not wrong less than latest by 3.5 months. If you go latching beyond 3.5 months, it is it can cause overfeeding, especially if you have a lot of breast milk. It can cause overfeeding. It can cause digestion issue later on, because overfeed, how do you feel when you eat like 7 buffet meal in a week? You will feel uncomfortable, right? So you can soothe your baby. Baby really need to come close to you for comfort suck, especially before sleep when they are less than 3.5 months. Some babies are fine. Even if you are not breastfeeding, please keep your baby close on your chest, because that calms the baby nervous system, and it is a very good transition to the outside world on the mother chest first. Okay? Will it cause over reliance before bedtime? After 3.5 months, yes. It becomes a bad habit. What you say is over reliance. We don't say over reliance. We general term is creating bad habit, like need to latch. And then if you do that, but how old is your baby? How old is your baby? How old is your baby? Over reliance is like creating bad habits. Oh no, you are doing fine. You are doing fine. Good. You are breastfeeding. Mother must be relaxed. Everyone else is to support her of her wish to breastfeed or not to breastfeed, or when to wean off and all that. Okay, because it is not easy. It is really not easy. Make sure you maintain a proper latch. If you want to have better feeding result, make sure you have a proper latch. Okay? It is important. So a lot of learned knowledge nowadays, because it's unlike in the past. We really, the first time we carry a newborn is probably our own baby. And last time is like growing up in extended family, we get to see how auntie's mother doing all the baby care breastfeeding. So now it's all learned knowledge. Learn as much as you can. So maintain a proper latch, the position, the proper latch. Okay. How to prevent the soreness? Doesn't mean the baby latches on, baby will get the milk. How do you have better feeding result? In case there's any blocked ducts. Okay, blocked ducts is like a little bit hard, like a lump. Okay, the milk is accumulated inside, but it's not coming out. So what can you do? You have to feel your breast before and after feeding. And you have to do breast massage. Breast massage. Loosen it. Drink some warm water. Take a few deep breaths. Especially when you are nervous, right? Or when you are very in a rush, it can affect the feeding. So how can you have a better feeding result? Is like you do the 4-8 breathing techniques. It's like you breathe in to the count of 4, and then you breathe out to the count of double the 4, 8. Okay, you breathe in. Do it a few times before you breastfeed if you are feeling tense up and nervous, because it affects the feeding as well. So massage your breast. If you wonder like what else can you do, okay, you can do one more thing. Amber, thank you for joining. Give me heart. Give me click on the heart shape. Give me 10 heart shape. Okay, like and share if you wish. Click on my bio for more information after the session. I'll be sharing family, mother, baby tips, topics. Okay, let me know what you want me to share. I'll be sharing from Monday to Friday during lunchtime, somewhere between 12:30 or 12 to before 2 p.m. So it depends. Sometimes in my shop, I may have some walk-in. Some of my clients, they just love to walk in because they are nearby. Then I will be like, oh, stop. Then I have to. Okay. If not, I would be on live TikTok. I'll be answering your question. If there's anything you want. Hello, Raj. Yeah. Hello. Like and share. And today's topic is about feeding. Okay, how can you have better feeding result? Number one is Breastfeed, of course, as far as possible. If you are breastfeeding, maintain the proper latch to have better feeding result. So massage your breast, and what else besides massaging your breast? What you can do is also to what, huh? To use warm compression. Use warm compression like 15 to 20 minutes before the feeding time. So when it is warm, it is flowing, it is soft, okay, plus your massage, okay, the milk is ready to flow, easy flow to the baby. And some of my clients, they actually take the lecithin to thin the milk for easy milk flow. Okay. So always remember, for feeding, better feeding result, it is always to feed before the crying stage. I am the baby listener. I'm the certified baby language instructor. I'm trained in decoding baby cries. So that means if parents give me a video recording of her baby behavior and so-called the cry, not the screaming, shouting, I'll be able to tell the parent what is that cry about and what action to take to calm the baby. Okay, so I'm going to share with you, how do you know that your baby is hungry? It is the ne, they say. Before the crying stage, you have to hear for ne. Okay, it can be ne, it can be ne. So it depends on how your baby expresses that. Okay, catch it before baby gets too hungry and before the needs to drink milk becomes too over, their blood sugar level already dropped, they are too eager to drink milk, they are in the hysterical cry already. So avoid that. Here for the ne. Okay, or ne, depending on how your baby expresses it. Okay, so feed when your baby is hungry. Feed when your baby is hungry. What is your take on pacifier on breastfeeding mother? You need to tell me how old is your baby, because the same techniques, the same thing for the different age of the baby at different stages of development and growth is different. So I can say yes and no depending on the age, depending on the situation. So how old is your baby? 2 months. It depends on what is your purpose of giving pacifier. Even though breastfeeding moms, some may advise you that you don't have to burp your baby. Have you ever experienced that? Some people, they actually advise, they told you that breastfeeding mom, actually you don't have to burp your baby. Is it true or is it a myth? Is it true? It is not true. A baby can ingest wind not only during breastfeeding. Yes, Lord. So they can ingest wind when they sleep. Watch, when they sleep, they open their mouth, then you close, then they open their mouth again. Okay, they will still ingest wind. When they cry too much, they ingest wind. Depending on how you bathe your baby, they can also ingest wind. So many reasons, or they can actually, the aircon is blowing too strongly, the fan is too strongly, the environment is too cold, or you bathe the baby too late and all that. They can actually ingest wind and they can actually have a lot of wind. It doesn't mean that breastfeeding mom don't need to give pacifier. So what is your take on pacifier for 2 months old? If you are giving pacifier to help the baby burp, okay, then it is okay. If you are not, if your milk supply is over too much, too much nutrients already, mommy, too much nutrients. Then you can't give direct latch because baby will drink in extra milk. So then you give pacifier for comfort suck before sleep if your baby wants a comfort suck before sleep. If you always give pacifier before sleep, it becomes a bad habit after 3.5 months. Okay, because we are talking about stages of growth and development. Okay, break down your question so that I can make sure that I answer what you are asking for. Because this is like a big general question to me, because when it comes to baby, it's very, very specific, to the point, to the dot. It's very specific. I can tell you when like one of my mother that I support, right, her name is Jake, and from her baby crying, I told her her baby was looking for her, and she was so like impressed, because before that she didn't tell me any background content of her baby cries. She just showed me the video, and I told her your baby seems like he's looking for you. Okay, so even if you don't do like breastfeeding or direct latch, you exclusively do pumping, you still need to hold your baby on your chest. Okay, that's what I always advise my student in my newborn preparation class. Okay, did I answer your question? Hello, thank you for joining. Give me heart shape. We are coming to an end already because I started at 12:30. All right, no problem. I have time. I can also answer your question. Did I answer your question? 2 months, what's your take on pacifier? All right, clear? Thank you for joining. And then, what is next? Where am I? Feeding routine, remember they don't have a fixed schedule. They don't, just now I was talking about feed before the crying stage, okay? Crying can ingest wind, you give pacifier to bring the air bubbles up, okay? By the time when they like speed up the pacifier, that's the time when you burp them. Do you know or not? You burp them. And how you introduce pacifier, how you introduce the milk bottle is also got techniques on it. Not plug in, plug out. Scary or not? I give you a take out, I give you a and pacifier, remember, it is never used as a plug in to shut up the baby. The best is don't bring, hello, welcome. Bala, right? Bala. Yeah, welcome. And don't bring the baby out because when they are young, especially less than the first few months, don't bring them out. Because when you're outside, when baby is crying and you don't know what specifically exactly is that cry, to confidently calm the cry, right? Like for me, I can tell, but because I'm a baby listener, I'm trained in decoding baby's cries. But for most parents, sometimes when they are stressed out outside and all pairs of eyes are looking at us, right? It is very hard for us to keep that calm and then know what to do to calm that cry, to tune in. It's very hard. So some parents like just out of no choice give pacifier. Pacifier should not be used in a way that is like plug in, shut up. It should not be like that. Yeah, it should not be like that. Hello, SK. Welcome. So let me know if there's any concern or topic you want me to cover. I can do it in tomorrow during. Yeah, good. Do it in the live Zoom as well if I don't have enough time today to finish. Aiyo, give me a while. Yeah, so it's very, very interesting when it comes to baby. I love newborn babies 0 to 3-4 months because I feel like they need me. Yeah, I'm their translator. I can hear them, and then I especially can tell the parents what the baby is, what the cry is about, and then what to do to calm the cry. It is very precise. There's no guessing game. Guessing game. So feed your baby when your baby is saying nah. Some babies say nah. Some babies say They have a lot of noises. Suddenly there's a very soft and then off. And some baby say nah, some hungry mommy, where's my meal? So it depends on how your baby express. Okay, express. Always tune in and respond to your baby fast enough, because I've seen like 5 months old baby, right? The parents told me like years back. The parents told me, Sharon, what to do? My baby wants something, means wants something now, cannot wait, you know. I told her it was not true lah. Not that cannot wait, but waited too long, and they are conditioned to wait because you don't respond. And then by the time I'm very, very urgent, you also don't respond. So I you know, tolerate lah. The hunger I can tolerate until really too hungry already, blood sugar drop already. Then parents thought that it was like the screaming, the cry murder episode. It was not. Okay, so respond fast. When your baby is hungry, you must know, you must be ready to feed, because up to a year, because they grow so much in the year. After 1 year, my student, my client, not my student, my client, who knows me later, not in my newborn preparation class, they told me like, baby, Sharon, is it normal that my baby is not, the weight is quite stagnant, like never increase already? Yeah, they are not growing, they are not putting on weight as much now after 1 year. I say if they continue to grow the way they grow in the first year, because massive growth and development in the first year, from the day they are born until the first year, okay, massive development. If they are going to continue growing like that, can you imagine? They will grow to be as tall as a tree. Okay, so a lot of baby care is the stages of growth and development, because from newborn until they can roll over, until they can sit up, until they can crawl and all that, until they can walk, massive development. Also the brain development. So we want to avoid that crying, because crying will cause prolonged intense crying, like every day screaming, shouting, cry murder episode, the bloody cry and all that, right? Hysterical cry, yeah, every meal like that, is going to affect the developing brain. And because of the stress hormones, the cortisol circulating in the system, it can be damaging to the developing brain. So we need to avoid the crying, avoid ingesting of the wind, act fast. Okay, there is no fixed schedule. There's a natural cycle of the natural rhythm from waking up to sleep. There's a natural rhythm. So you have to catch at least 2 timing. When do you expect baby to wake up? When is baby hungry? When do you expect baby to be tired? So about these 2 timing, keep close to your baby 15 minutes earlier to catch the cue signs and what they say. Okay? So when they say that your milk must be ready, your breast must be ready, so your breast massage and all that, feel your breast before, after breast, before feeding, to have a feel. Okay, so it is very important to act fast. I see many parents taking action too slow. I observe baby. Many first-time parents or first-time grandparents or helper or what, they like to do what, you know, I tell you, I observe, because I also do home visit consultation. You know what they like to do? You Chinese, Japanese, Lee, I'm a Chinese Singaporean. I'm a baby listener. I'm trained in decoding baby's cry. I'm a certified baby language instructor. I'm a Chinese Singaporean living in Singapore.